Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm pleased to provide the Public Health Weekly Update for March 9th, 2023. This week, we're going to go back to what we were doing some weeks ago, which are what are the best steps we can take to live as healthy a life as possible. Remember, we've talked about cigarette smoking, overweight and obesity, sleep, exercise, and most recently, alcohol. But now I'm going to ask a question that resonates with a lot of people, which is, should I have a pet? Is there value in me having a pet? Now, I have to tell you, with all of the other ones I've done, I've been fairly impartial. But this one's a little bit more difficult for me because for my entire life, I've lived with pets, dogs, cats. Every country we've lived in, we've had pets. And even to the day today, we have three dogs and a cat. And so I will try my best to be impartial, but obviously I have a preconceived notion about the benefits of a pet. I'm going to do this presentation in two parts, one part this week, one part in an upcoming week, which is what are the health benefits of having a pet? And then next time I'll do what are the health risks of having a pet. So let's do a little bit of review. Dogs were domesticated probably 20 to 40,000 years ago. Cats were domesticated more recently, horses more recently still, but they've been a part of human life for a long, long time. And they're very widespread. Just in our country, about 70%, over 2/3 of families have a dog. 2/3 of families have a pet. 69 million households have one or more dogs for a total of 90 million dogs. There's 94 million cats. So cats are in less households, but there are more of them. Fish are, in fact, the most common pet that we own because the average person who has fish has 12 of them. There's many birds, small animals like gerbils, rabbits, guinea pigs, and then a number of people have reptiles. Over 80% of the states, over half the households include at least one pet, but this may surprise you. Wyoming is the most likely to have a pet in the household. Montana is most likely to have a dog. West Virginia is most likely to have a cat. Rhode Island is the least likely to have a cat or any pet. And Connecticut's least likely to have a dog. And that probably reflects the urbanization of those latter two states. I heard a statistic when I was preparing this. It really sort of surprised me. And that is that more American children live with a pet than live with their biological fathers. I can't document that. I can't find the statistic, but it looks consistent with these. So let's look at what we know about the benefits of having a pet. According to the Centers for Disease Control and Prevention, there are many benefits. Increased opportunity for exercise, of course, and that exercise itself, not just the pet, will reduce blood pressure, cholesterol level, triglycerides, and so on. They can help mitigate loneliness and depression. And they show that the bond between pets and humans, of course, as we mentioned, blood pressure, cholesterol, triglycerides, loneliness, anxiety, and symptoms of PTSD. And again, exercise, opportunities for exercise. There was an interesting article about 4 years ago in this journal. It was published in French and English. But they sort of laid out the benefits of having animal companionship into three categories. Pets, companion animals, contact with an animal, in other words, using an animal for a short term in a nursing home or a hospital, and then animal-assisted intervention, animal-based therapy. I'm not going to talk about the second one, or in fact, the third one today, because I really want to focus on the benefits for what they are of having a pet. And this article points out that most studies on animals and humans do cross-sectional analysis. They ask people, do you have a pet? And then they follow up their health-related issues. And this article documents less depression and loneliness among older adults who have pets, less depression among bereaved adults, less loneliness among single adult women, less stress in autistic children and their caregivers, and of course, again, this issue of physical activity. So in their summary, they say that there's epidemiological and experimental evidence that companion animal ownership provides benefits to the individual who wishes to keep. But here's the problem with almost all of these studies is if you think about it, you're asking someone, do you own a pet? Yes, no. How do you feel? Are you depressed? Are you happy? Are you physically active? But what we haven't done there, that's not a randomized trial. It's just like the trials we talked about with masks and COVID. You can't randomize it. You can't say to someone, here, take this dog for the next 10 years. And so what you're left with is not knowing whether someone who perhaps doesn't have a dog because they can't be physically active may explain why dog owners are more physically active, or someone who's depressed may be less likely to get a cat or a dog. I'm not saying that's the case, but it makes it very difficult to conclude from these types of studies that there are the benefits that folks would like to claim for pet ownership. Now, we do know that having pets in the home for children, if the pets are appropriate and safe for that child, and we'll talk about that another time, can have many benefits, including self-esteem and self-confidence, developing trusting relationships, and then serving a variety of different purposes. So at the end of the day, should I have a pet? If you go strictly on the data, I would say, yes, it tends to lean in the direction, but I think it's not as convincing as most of us would like. Having said that, as I said in the beginning, I am not impartial to this. And you think about anything that's been going on for 10, 20, 30,000 years isn't just a random thing. There's clearly a benefit for humans and their pets to being with each other. I do believe that they reduce loneliness. They encourage socialization. They make you feel good. As some reports have suggested, they probably increase the release of oxytocin when you pet them. So yes, I think at the end of the day, all things being equal, people should have an appropriate pet. I'm not talking about exotic animals. I'm not talking about dangerous animals. I'm certainly want you to be very careful if you have young children and toddlers in the home. But by and large, I think the answer is yes, there are health benefits to having a pet. In a future week, I will do the health risks of having a pet. But until then, please feel free to share this video with anyone who might be interested. I'd like to thank Dara Young for editing, producing, adding captions, and posting all of these videos for the past 3 years. And obviously, if you have any questions or comments about this issue, the pet issue, or any other issue that I've addressed, please let me know. And if there's any evolving or emerging public health issue you'd like me to talk about, please let me know. I do look forward to hearing from you. And until next week, please be well.